70's time is 6:49, and with our morning checkup with Samaritan Medical Center this morning, Dr. Fahd Rawra is here to give us details on postpartum depression and some interesting stuff. Good morning. Good to see you.
Good morning.
I guess let's define this first. What does that mean?
Okay. So postpartum period, right after a female gives birth to a baby. Three different illnesses that can occur in this period that I want to talk about.
Three separate?
Yes, three separate entities or illnesses. One is postpartum blues, second is postpartum depression, and the third is postpartum psychosis. Postpartum blues is more of a milder form. It can actually affect up to 50% of the people, but it's very mild, it's self-limited. Symptoms include mood swings, irritability, some sleep issues, some problems with concentration, maybe some sadness. Usually occurs within about a week to 2 weeks of giving birth, and self-limited, so mild symptoms. It doesn't affect your functioning, and it's usually done within a week or 2 weeks.
Mm-hmm. So it's temporary?
It's temporary, and you don't really need to get any treatment or anything for it.
Okay.
Postpartum depression is a more severe form, and it's a depression, so you'll have your problems with sleep, loss of interest, guilt, low energy, problems with concentration, feelings of sadness, severe mood irritability. People will notice it around you, and the big thing is it affects your functioning, so it affects your ability to bond with your baby. So that's kind of the big thing, you know, right? You have
that's pretty
a baby.
serious.
Yes, absolutely. And that's something you'll want to get treatment for. Then we have postpartum psychosis. That entails things like hallucinations, problems with your, or getting confused, okay, paranoia, and delusions. So it's actually pretty bad. I don't know if you guys remember the famous case of Andrea Yates.
Yes.
She's a female who actually drowned several of her children, or all of her children.
In the bathtub?
In the bathtub, yes, because she felt that they were possessed by demons, and that was the only way to take the demons out.
Right, she felt like she was saving them.
So, I mean...
So that was definitely psychosis.
Yes, absolutely.
With the first part, you said blues can be something that can happen 50% of the time.
Yes, with 50% of people.
50% of the people.
Yes.
How often do the other two stages happen?
I don't remember off the top of my head, but I would say the depression, the postpartum depression, probably around 5% or less.
Okay, so it drops significantly.
Yeah, absolutely,
yeah.
absolutely. So you can have 50%. Sure.
And do these people realize that they are suffering from this? I feel like they don't. No.
I think that when you're preparing to have a baby, there's a lot of excitement there. Some things are acceptable for when you're done having the baby.
Right.
Some tiredness, obviously sleep is affected, but not just the mother, but people around you might be the ones pointing it out and helping you out.
And
hey,
they really need to.
Yeah, you know, mother's always there, grandmothers are always there. Like, hey, that's not how you're supposed to be caring for your baby, and how come you're not attached to your baby, and why are you saying these odd things about the baby, that kind of
Is it good before you have the child to kind of talk about this with family or the doctor? Yeah.
Absolutely. I mean, the blues definitely, because it's so prevalent and it's 50%, like I mentioned earlier. The depression and the psychosis, it's something that would be caught by people around you, your family members, friends.
All right. Very good. Thanks for the information.
Important information.
Yeah.
Thank you.
Thanks. We're back here in a couple of moments.